Hello, Dr. Rima here from Rima's Regime. Today I'll be discussing about the dietary management of menopause. But before that, I will briefly elaborate what menopause is. Menopause is a natural biological process resulting in cessation of the menstruation and fertility. It occurs once 12 months have passed since the last menstrual period. There is a fall in the female hormones, estrogen and progesterone. It generally occurs around the age of 50. The ovaries stop producing the estrogens. The perimenopause occurs in the age of 40. It is a stage of natural transition to menopause and can last from few months to few years. Initially, there is increase in the estrogen level. It is accompanied generally with the heavy or irregular periods, hot flashes, and night sweats. Premenopause is a stage where there is no noticeable change but hormones shows transition. Hormonal and metabolic changes marks the onset of the menopause. The follicle stimulating hormone and luteinizing hormone of the anterior pituitary fails to regulate the levels of estrogen, progesterone and testosterone. The reduced level of estrogen results in vaginal dryness and reduced libido. Weight gain, obesity, and high risk of cardiovascular and metabolic diseases are significant. Alleviating symptoms and weight management are major concern. Causes of early menopause include the removal of ovaries, hysterectomy, cancer treatment like radiations, chemotherapy targeting the pelvic area, and at times family history of early menopause. Common signs and symptoms of menopause include irregular menses, in which there is a missing of periods for a month or two and then returning to normal, heavy flow, hot flashes, chills, vaginal dryness, mood changes, night sweats, sleep problems, dry skin, hair thinning, loss of restfulness, reduced metabolism, and weight gain. As a result of these symptoms, there is anxiety, depression, headache, fatigue, and insomnia. The main health concerns include counter and manage estrogen deficiency, sexual problems, cardiovascular diseases, osteoporosis, urogenital atrophy, and estrogen-dependent carcinoma of breast, ovaries, and uterus. The most significant risks include hypertension and acute myocardial infarction. A range of lifestyle changes makes the symptoms more tolerable. Hormone replacement therapy helps most women to overcome these symptoms, but some women cannot go in for it due to health issues. We must aim at reducing the symptoms by increasing the physical activity, consumption of a well-balanced diet, and modifying any detrimental lifestyle. A well-balanced diet aims at meeting all the nutritional requirements in a suitable proportion and amount. Modifications are advised to relieve the symptoms of low bone density, sleep problems, and hot flashes. The reduced level of estrogen increases the risk of osteoporosis and thereby fractures. Incorporating dairy products which are rich in calcium, vitamin D, potassium, magnesium, phosphorus, and potassium is advisable. Inclusion of low-fat milk, cheese, and yogurt, and those who cannot digest dairy must look for foods which are fortified with calcium, such as juices, especially orange juice, and those which are naturally containing calcium, examples makhanas, then spinach, kale, and so on. A minimum of 3 to 5 servings of fruits and vegetables is must for optimal health. They provide us with vitamins and minerals, antioxidants, and fiber. At least half the plate should be filled with fruits and vegetables. The cruciferous vegetables are very helpful. They provide us with the phytoestrogens, which protect against the diseases like breast cancer. A fistful of berries like blackberries or blueberries, they help to reduce the blood pressure. Drink ample amount of water. Vaginal dryness and dry skin due to low estrogen levels can be controlled to some extent by drinking around 8 to 10 glasses a day, which helps to maintain the skin moisture. We can obtain some amount of water in the form of food, especially fruits and vegetables. They contain a large amount of water. Drinking water reduces the bloating, which is due to the hormonal changes. Consumption of whole grains during menopause is essential, like barley, quinoa, oatmeal, brown rice. These provide us with B vitamins to boost energy, promote digestive health, and also manages the stress. Include phytoestrogen foods. Phytoestrogen acts as weak estrogens in body and tries to compensate the reduced level of estrogen. These include soybeans, chickpeas, peanuts, flax seeds, barley, grapes, berries, plums, green tea, and black tea. Since the fall in the estrogen from menopause is associated with the reduced muscle mass and bone strength, so high quality proteins must be included in our diet. These can be in the forms of eggs, meat, fish, legumes, and dairy products. We conclude that inclusion of dairy products, healthy fats, whole grains, fruits, vegetables, and foods especially high in phytoestrogens, along with quality sources of proteins, definitely helps us to relieve the menopausal symptoms. Thank you for watching. Follow my channel and find me on Facebook and Insta for many more such tips.